Okay, good morning, student. So you can, all of you, can you please on your video? Hurry up, hurry up. Please don't waste time, okay?
Hello, ma'am.
Yes, yes.
Hello, ma'am.
Yes. On your video.
Ma'am,
Yesterday,
can
yeah,
I,
yeah, Girija, say.
ma'am, can I turn off my video?
Yes. I just for a second, I told you to turn on your this video. It's no problem if you have problem then.
Okay, ma'am.
Samuel, where are you? Samuel, you're outside?
मैम घर का बाहर है नेटवर्क ठीक
Oh,
नहीं है
okay.
मैम घर पे
Oh, okay. No problem. Okay, all of you can off now. Okay, so like yesterday we have discussed about nephrotic syndrome. So like whatever remaining management, this complication, all these things that you all already know. So if you have doubts, then you can ask me. And then besides that, yesterday, this Darshana had mentioned that she want to discuss about the hypertension associated renal disease as well as pregnancy associated renal disease. So that combination one day we can't do two, so today we will like discuss on hypertension associated renal disease. Okay, so all of you have already the notes now, so you while we are having revision, so you can just turn your pages so that you won't have any confusions. Okay, all of you, can you see the screen?
Yes, ma'am.
Okay. You just wait a minute. Okay, I don't know what happened since yesterday, like there always problem arise while sharing the screen. You just wait just a minute. How is your preparation for exam, all of you? How is your preparation?
Good ma'am.
Completed all the
Good, ma'am.
syllabus? Everything completed all the syllabus?
No ma'am.
It's for 60 marks. Now you just try to get good mark, okay? Like in all the subject you try to get good mark. And especially I want you all no one, okay? I don't want to see any name getting backlog in this CRD, okay? So please don't try to get backlog in CRD. And all of you have passed the like first sessional and the second sessional exam now. Like I could see all of you have passed, so it's a great news. So but once you do your like final bet now, so that won't be this first sessional and second sessional can't help you now. So and there is also an internal assessment now. So that's why be careful, okay? Your attendance, your this performance, everything based on all those, also everything marks is there. Okay, now let me try to share the screen. Okay, now you can see, right?
Yes ma'am.
Yes, ma'am.
Okay, now it's okay. Okay, the heading is hypertension associated renal disease. Okay, so let's begin. So the introduction that we have discussed was renal hypertension, which is also known as renal hypertension is also known as what? Renal hypertension is also known as, it's written in the first line.
Renal vascular hypertension.
Yes, very good. Renal hypertension, which is also,
Renovascular hypertension.
okay, good. Renal hypertension, which is also called renovascular hypertension. This is an elevated blood pressure which is caused by kidney disease. So any kind of hypertension that is caused by kidney disease, okay, those are known as renal hypertension, or else it is known as renovascular hypertension. So all these hypertension, it can be controlled by blood pressure drugs, or with the help of not only the medicine nowadays. Apart from medicine, what things can you do, Samuel? I have taught you all that day very nicely. Apart from medicine, there is also some changes that you can perform by yourself. What was that?
Exercise activities.
Yeah, what was the name of that? Life something? What was it? Lifestyle changes, isn't it? Yes or no? Okay, so lifetime change, this lifestyle changes and all. Okay, those are like nowadays. What happened is that people don't like mainly prefer on all this medication. Okay, medication sometimes that should be the primary treatment. Okay, but apart from that, the lifestyle changes is very much important. So if you maintain your diet, everything, then what happened is that you don't need to consult the doctor like each and every day. So that's all about the introduction. So coming to the next is how does high blood pressure affect the kidney? So let us see how high blood pressure affect our kidney. So high blood pressure, it can constrict and narrow the blood vessel. Okay, so when किसी इंसान का हाई ब्लड प्रेशर होता है तो क्या करता है, जो हमारा जो ब्लड वेसल है ना, वो कंस्ट्रिक्ट करता है या फिर नैरो करता है. कंस्ट्रिक्ट नैरो ऑल सेम. ओके, नैरो कर देता है जब हाई ब्लड प्रेशर होता है. So which eventually damage and weaken them throughout the body, including the kidney. So when there is a narrowing of the blood vessel, what happened that this will also like hamper our kidney. Okay, it will damage our kidney and even weaken the function of the kidney. Okay, so and then because of this narrowing of the blood vessel, the blood flow will be reduced. So अगर किसी blood vessel में narrow हुआ तो क्या होगा, तो जो blood flow normally जो blood flow होता है that will reduce. So this is how this high blood pressure can affect our kidney. Okay, and next is if the kidney blood vessels are damaged, just now what we have discussed. Okay, if the kidney blood vessels are damaged, they may no longer work properly. So when this happens, the kidney are not able to remove all the waste and extra fluid from the body. So what it says, what this line says is that when our kidney blood vessels, okay, हमारा kidney में blood vessels होता है, तो means the blood vessels that are, if the blood vessels that are present in the kidney are damaged, then what happens is that our kidney will no longer work properly as it used to work before. Okay, so and then like and then if the kidney will not be able to work properly, then what will happen is that the kidney also will not be able to remove all the waste and extra fluid from the body. तो उसका वजह से क्या होगा, किडनी जितना रिमूव करना है वो रिमूव नहीं कर पाएगा, तो there will be accumulation of fluid in the body that will lead to edema. All these right problems are seen. Okay, so and it is a very dangerous cycle. Okay, so and if it keeps on, if the kidney, because of this narrowing of the blood vessel, if your kidney function is like hampering, and if your kidney is like damaging, okay, slowly and steadily it keep on damaging, the damage is progressing and progressing, then what happens is that it can ultimately lead to kidney failure. Pura kidney fail ho jayega. So that is why we have studied the acute kidney failure, chronic kidney failure, all those things we have discussed. So are you clear how does this high blood pressure can affect your kidney by narrowing the blood vessels? Are you clear, all of you?
Yes, ma'am.
Yes, ma'am.
Okay, this is very interesting. Okay, next, let's move on. Who is more likely to have high blood pressures or kidney disease? So let us discuss. कौन सा लोग है जो high blood pressure या kidney disease affect होने में ज़्यादा chances होता है? So who are more susceptible? Okay, so let us discuss high blood pressure. So following are more likely to have high blood pressure if they are older. So as compared to the child, as compared to the adult, okay. So the who are advanced age, okay, जो लोग like उम्र में ज्यादा होता है, like those who are like elderly person, okay, old age person, their blood pressure tend to increase with age. As their age fluctuate and increase, okay, their blood pressure also increase. So our blood vessel naturally thicken and stiffen over time. So what happens is that as you grow older and older, your blood vessels naturally will become thicken, okay, ज़्यादा thick हो जाता है, thick, and then stiffen over time and time. So that is why those who are older person, they have like they are likely to have high blood pressures. And the next is have family member with high blood pressure. So if there is like any member in your family, okay, suppose your mother and father, example, it's just an example, suppose your like parents are having a high blood pressure, so their daughter or their son, okay, it had great chances of developing this high blood pressure. So that is why this family history can also be the family history can also be the risks, okay, for developing this high blood pressure. So, and then coming to the next, have unhealthy lifestyle habit, which we always keep on this case. So जिसका unhealthy lifestyle habit है, हाँ, they are likely to have high blood pressure. So unhealthy habits such as eating too much of sodium. So we always, I always used to mention that if someone have high blood pressure, then he or she should have less intake of salt in his or her diet. So what happened is that if your this lifestyle habit, okay, your lifestyle habit is unhealthy, that means sodium kam khana tha, salt kam khana tha, but you are eating too much of sodium and you are not maintaining your proper lifestyle, okay, you're not maintaining your proper diet, then these can also be likely like the risk to have high blood pressure. And drinking too many alcoholic beverages, so there are some alcoholic beverages, so if you drink too much, that can also can be the chances to develop high BP. And then not being physically active can increase your risk of high blood pressure. So if you're not physically active, if you won't exercise daily, okay, like if you are lethargy, then this will hamper and then lead you to like diseases like high BP and all. So the 3 point we already got, then are male. And then men are more likely to develop high BP before the age of 55. Okay, women are more likely to develop it after 55. So what happened is that when we talk about high blood pressures, the men are more likely to develop high blood pressure before the age of 55. It's not like that, okay, that the men will have high BP, women will have low BP. It's not like that, okay. The only thing is that the age difference is mentioned here. So when the man age is before 55, then he will have likely to develop this high BP. And the woman, if after they cross 55 years, now that is, we before also we studied, now after menopause, the woman, the BP used to increase. So that is why this is what we can see. So the following are the some of the points that who will have likely to develop high BP. One is if you are older, if you have family history of high BP, and if you have if you don't maintain any healthy lifestyle habit, and if you are male. So these are how like high blood pressures can be like seen, okay, in this habit. So next is kidney disease. In addition to high blood pressure, that is along with high blood pressure, okay, in addition to high blood pressure means along with high BP, other factors that increase your risk of kidney disease are diabetes. Suppose you are having a high BP, okay, and then you are also having a diabetes and also a family history of kidney failure. Then what happens is that these are the patient, or these are the person, okay, who are more likely to have develop high blood pressure or any kind of kidney disease. So this is all about high BP, who will have likely to have high BP as well as kidney disease. So are you clear with this 2 points? All of you?
Yes, sir.
Yes, ma'am.
Yes, sir.
Okay, try to know all this, okay. खुद का daily life के लिए भी बहुत फायदा है, because this diabetes, this hypertension, ये सब तो इतना common है ना, So it's like even your parents are also having all this, then you can give them like instruction, okay, ऐसा करना है, you do like this, perform this, every time doctor के पास नहीं जाना है, खुद maintain कर सकता है, like that you can tell them, okay. Means like you're studying as a dialysis student will help you, okay, to treat not only yourself, it will also help to treat your family. Next. So next is the causes of renal hypertension. So let us study the causes of renal hypertension. Renal hypertension is caused by a narrowing in the arteries, which we already discussed now, that agar means वो blood vessels narrowing होने से क्या होता है, like because means hypertension can affect the this blood vessel na, that is it can lead to narrowing of the arteries. So renal hypertension is caused by narrowing of the arteries that deliver blood to the kidney. So there is an artery, okay, that used to deliver the blood to the kidney. वो artery के through से blood जाता है, okay, to the kidney. So what happens is that the artery that supply the blood to the kidney, if there is narrowing in that artery, then that can also be the cause of renal hypertension. Or one or both kidney arteries may be narrow. This is a condition called renal artery stenosis. Stenosis का मतलब narrowing है. So this is the main causes, okay? So narrowing in one or both renal artery is most often caused by atherosclerosis or hardening of the arteries. So this is the same process that led to many heart attack and stroke. LS common cause. So the most common cause was this atherosclerosis, okay? That is narrowing in one or both renal artery, okay? So we have we have two kidneys, okay? So if there is in both the arteries of that kidney, if there is narrowing, then that can hamper, okay, the blood flow to the kidney. So this is the atherosclerosis. This is the main causes. And this fibromuscular dysplasia, this is also the cause, okay, the cause of renal hypertension, but this is the less common cause. It is not that much important. So are you clear with the causes, or do you want to ask anything? I already gave you all the meaning of atherosclerosis also. So what was atherosclerosis? Rashmi, what is atherosclerosis? I already give you all the meaning. So I don't want to waste time in all these things. What is atherosclerosis? Srijana, can you please tell me what is atherosclerosis?
Ma'am, hardening of the arteries.
Yes, it's written here, all of you, like, please always see the slide nicely, okay? Hardening, when there is hardening of the artery, that is when your artery is hardening, there is narrow, okay? Then what happens is that will like affect the blood flow to the kidney, okay? And this will hamper and it will lead to increase in blood pressure. So this is the main cause of renal hypertension. So let's move on. So the next is clinical feature, the most interesting clinical feature. So renal hypertension usually cause no symptoms, okay? The narrowing in the arteries can't be felt unless it is dangerously high. High blood pressure causes no symptoms, either symptoms of severely elevated blood pressure include. So these are the, like, what happened is that this renal hypertension, okay, it usually cause no symptoms. Sometimes when the renal hypertension, when the hypertension that is caused is not too much severe, okay, then what happened is that the symptoms might not be seen sometimes. So obviously when someone's say that, oh, I have a headache, I have a dizziness, at that time what happened that we used to suggest maybe your BP is high, that's why you are having a dizziness, you are having a like headache. We used to suggest like that. And once you check the BP with the help of this sphygmomanometer, then only you used to you used to come to know that he or she is having a high BP. So what happened is that sometimes the symptoms don't used to be shown. Sometimes what happened is that some people don't used to have headache also. Some people don't used to have like dizziness also. Means chakkar bhi nahi aata. But still when you check their BP, what happened is that they used to have hypertension. So that means maybe they have like some problem in their kidney, okay? Maybe their kidney is damaged. The symptom is asymptomatic, but what happened is that like while checking the BP, you can find that he or she have high BP. Those are the asymptomatic things. So let us discuss some of the symptoms severely elevated, when the BP severely elevated. Okay, जब BP बहुत ज़्यादा high होता है तो what are the symptoms that we commonly see? Okay, so one is headache. So when someone have high BP, then what happen is that he or she will have headache, then he will have confusion. Obviously, पूरा dizzy होने से confusion होता है. Blurry or double visions, and they also, I already asked you what is the blurry. To you, all of you know now what is blurry. When you see something you can't see clearly, it's blur. So, and then double vision, and the other name of double vision also I already told you. What was the name of the double vision? That day I asked to Samuel, I still remember. And at the time he don't know, but I told him the answer. Samuel, what was that? You still remember? Double visions. I asked you, I still remember. Samuel, what was double vision? The other name? All of you get ready. It's not that I will ask only Samuel. Double vision. Double. Okay, Ishan, can you please tell me what is double vision? Ishan, can you please tell me what is the other name of double vision? Uska dusra naam. I'm not asking the meaning. You forgot.
Yes.
If you forgot, then say you forgot. I will ask someone else. You forgot? Huh?
Yes, ma'am.
You forgot?
Yes, ma'am.
Okay, okay, no problem. Okay. Who will tell me the answer? Nafishisa, can you please tell me the other name of double vision?
Ma'am, diplopia.
Yes, very good. Okay, so all of you who forgot this, now see, after revising again and again, also you all, sometimes I used to make you some, means I used to teach you all, you write it down, double vision, you bracket, you write diplopia. Those who are still confused, you write DIPLOPIA, diplopia. So, okay. Shital, is Shital present? If Shital is present, then can you please tell me the meaning of double vision? Double vision? Double vision? Tumpe, can you please tell me what is double vision?
Diplopia.
No, I'm asking the meaning, not the other name. The meaning.
Oh,
The meaning. Yeah, meaning. If you don't know, I will pass someone else.
Ma'am, double vision seeing two image on object.
Yes, very good, Tumpe. Yes, seeing two image of an object. Okay, means two image of an object. So each is called like one object. You will see two images. Okay, of that one particular object. So that is known as double vision. So what happened is that all these kind of sign and symptoms, okay, it is seen on when your blood pressure is too high. जब blood pressure बहुत ज़्यादा high होता है, severely elevated होता है, तब होता है blurry or double vision, ऐसा होता है. And then next is bloody pink color urine. Pink means like, I'm just mentioning the pink. It might be like dark color urine, because bloody urine means what? When you have hematuria, okay, when the blood vessels are being narrow or damaged, then that will affect the the blood flow, okay, to the kidney, and in between there can also occur some inflammation, and because of that it can lead to hematuria, and when hematuria occur, then you will see the presence of the blood in your urine. So all this can occur. So nose bleeding. So bleeding of the nose is also common, okay? Those are the clinical features. So are you clear? When you have severely elevated high blood pressure, you will see this kind of clinical features. So are you clear, all of you? All of you?
Yes, ma'am.
Okay. For your final questions, I am still modifying your final question. Okay, I almost submitted, so you just study whatever notes I have given. Okay, even the revisions, means the Shaban ma'am class you did not understand, even a single class also. So whatever revisions I had given you all, in there also I have added some extra point that also you just go through once and read it, okay? Like any questions I can give you. And the most importantly you need to focus is the important questions that I have given you. I have given you all so many, okay? So once you start, whatever I have given you all, if you study very nicely, I'm pretty sure you will get 60 out of 60. You will get full mark. So don't only just try to pass. I keep on saying, okay, try to get the best percentage. And then when you go for another admission also now, like anywhere, you will get an opportunity. So next is the treatment. So the most interesting is treatment. So firstly, medication are used to try to control high BP's blood pressure in renal hypertension. So I already discussed you all that when someone have high BP, so there is a there is a class of medication. I'm not asking you all the name of the medicine, okay? I'm just asking the class of the medication that I have given you all. So what were those? What were those? Started with SC something. Oh, I'm telling the answer. Say, tell me blood pressure ज्यादा होने से क्या class of medicine दिया जाता है? Say, any one of you? Bishal, can you please tell me? Bishal. See, let's not waste time. See, again, the time will be short. Bishal, बोलो तो blood pressure high होने से कैसे type का class of medication दिया जाता है? Tell me. You forgot?
SC has
Okay, Darshana, say.
SC inhibitor
And what? SCE and
angiotensin to receptor blocker.
okay, you see my notes. The most important blood pressure medication to treat renal hypertension include SCE inhibitor. Okay, so SCE stand for, in the question if I give what are the like important blood pressure medication to treat renal hypertension, okay? Or else if I will give like this, what are the important like blood pressure class of medication, okay, that is used to treat renal hypertension, then you have to write like this: SCE inhibitor, all this you have to choose the correct answer. So SCE inhibitor, so that which is also known as angiotensin converting enzyme, and these are the medicines. So the medicine are not that much like you need to memorize, okay, for now. Just at least try to know, okay, that like कौन सी class का medication दिया जाता है, that is. Srijana, please take attendance. That the other one is ARBS, that is angiotensin receptor blocker. Okay, Vishal?
Okay, ma'am.
See this true, it's very written very nicely. See, SCE inhibitor, uska naam hai angiotensin converting enzyme inhibitor. And next is ARBS, that is angiotensin receptor blocker. So these are the name of the class of drug, okay, that is used to be given to those patients whose BP are high. And if you want to know the name of the medicine, then these are the name of the medicines. So the last line, what it is written is that many people require 2 or more medication to control their blood pressure. So what happened is that some of them, like some patient with one medication, with one blood pressure medication, okay, it might not be like the patient might not be healed or treated with one medication. So sometimes they require 2 or else more than 2 medication to control their blood pressure. So in addition to an SC inhibitor or an ARB, a healthcare professional may prescribe a diuretic, a medication that help the kidney remove fluid from the body. So before, what happened is that what I already mentioned you all is that when there will be narrowing of the blood vessel, okay, that is in the kidney ka jo blood vessel hai usme agar narrowing hua, so what happened is that will block the flow of blood into the kidney, is not it, or any kind of fluid from any kind of fluid flow to the kidney, okay, it will block. So once it block, what happens is that then what happens is that the kidney will not be able to excrete out the waste product, the fluid and all, no? So what happens is if the kidney cannot excrete out the fluid, the waste product, तो हमारा शरीर में जमा हो जाएगा. It will accumulate in our body. So once it accumulates in our body, then there will be formation of this edema and all, which I already mentioned. So if that occur, then what happens is that there is no option that the kidney is, the blood vessel is already damaged, then the kidney itself cannot excrete out. Then the only other therapy that or the other process that you can perform is to prescribe medication. Okay, so that is the medication name is diuretic. So we mainly give diuretic, okay, to remove the fluid that is present from the body, or else to excrete any kind of fluid that is present in our body. So that is how it works. Means like if someone have blood pressure, you need to give the blood pressure medicine, okay. In addition to that, means add karega. In addition to that, you can also prescribe diuretic, that is less sick and all, okay, furosemide, all these things. So are you clear with the treatment, all of you?
Yes, ma'am.
Yes, ma'am.
So the next is how to prevent or slow the progress of kidney disease from high blood pressure. So how to prevent, okay, or slow the progress of kidney disease from high blood pressure. So the best way to slow or prevent kidney disease from high BP is to take steps to lower BP. These steps include a combination of medicine and lifestyle changes. So this is the combination. All of you have class at 10:15. From 10:15, do you have any class?
No, ma'am.
Means actually, what class you are supposed to have today at 10:15? Or is it free, or is it?
It is free.
Sure, no?
Sure, yes, ma'am.
Okay. Then, like, I really want to complete this. Okay, so let's do one thing. So today I will complete this. Okay, so after the class is over, you join again, because tomorrow is holiday now. Tomorrow is first Saturday, so tomorrow the whole day you can enjoy. And Monday, like, we are already called to the university now with the faculty. We have to join the university. So on Sunday, on Sunday I will be like traveling. Sunday I will be traveling, and then with your Vanilla ma'am I will be going to Guwahati. So what happened is that Monday I'll be very tired, I won't be able to take class. So the class that I will be continuing now, okay, right now, that I will upload on this Monday. And then the attendance also, like I will be taking now itself. So is it okay?
Okay, ma'am.
All
Okay,
of
ma'am.
you? All of you?
Yes, ma'am.
Yes, ma'am.
Okay. So like now it's still only, okay, now it's for now, okay. For my next class I will continue, okay, how to prevent or slow the progress of kidney disease. We will discuss very nicely the medicine that we already discussed, and then we will discuss this lifestyle changes, which is very interesting. So for now let's end the class. Okay, thank you everyone.
Thank you, ma'am.
Thank you, ma'am.